We are here today to talk about a bill that will be offered by House and Senate Republicans that will allow teachers and school personnel to be considered essential after healthcare workers, those in long-term care facilities, the vulnerable. So kind of that first round, folks, we want the teachers and the school personnel to follow up on that. And I want to just emphasize here too, that this is no mandate that a teacher would have to get a vaccine. It would be voluntary, as they all should be. We all have friends and family that have kids that are struggling with not being in school. Our students are falling behind academically, and for many, their mental health is spiraling downward. Distance learning is just not the same. Kids need to be in the classroom. They need their teachers. But teachers and kids need to be safe, and this bill would help in getting schools back open both safer and sooner.
Minnesota families have been incredibly impacted by COVID and the impact of distance learning. They are stressed as they try to parent, work, and educate in partnership with teachers. There are teachers in my family, and so this is really personal to me. I want them to be able to do their job well. As someone who has friends across the spectrum, everything from homeschooling to children with special needs who have really intensive IEPs, I want children to have what they need as well. With limited availability of this vaccine, it's going to be important that the Minnesota Department of Health prioritize those things that are most critical to Minnesotans. And I completely agree, Tier 1A, our healthcare workers and those who are vulnerable. But then as we start to make decisions about the next tier, I think teachers need to be really high on that priority. And I agree with Representative Scott. It needs to be informed consent and voluntary. And I think it should be prioritized where those kids, as Representative Erickson raised, where those kids have had the most detriment from distance learning. And so I sent a letter to the Department of Health and Department of Education yesterday. I have raised this through phone calls earlier, but it is important that legislators on both sides of the aisle, first of all, acknowledge the importance to our families to have a stable, functioning education system in person. But more importantly, I think, to acknowledge that special ed kids are falling behind, that those children who are already impacted by disparities are falling further behind. Children with English as a second language are going to be even further behind in their success. And as someone who deals with pediatric mental health and health and human services, I can tell you our children are experiencing more depression, more anxiety, more ideation of suicide. It is critical that we give them some sense of normal as soon as we can.
For me as a teacher and as an educator, somebody who also was in athletic administration, what you see and you hear a lot about is that gap in achievement. And what you're noticing is that right now with COVID, with kids on distance learning, that gap is only increasing. Because when I'm thinking about the students who are coming from homes and from areas that they don't have the resources, their education is very different than the kids who are in class. If I'm a classroom teacher sitting here with all 35 of my students, I can give kids the same experience. I can give them the same love, content, and description that I want to give them because I have them here in person. When they're in distance learning, I'm requiring that they have to have the same availabilities, and they don't. Some kids have laptops. Some kids have computers hooked up to 32-inch monitors. Other kids have cell phones that they're looking on a 5-inch screen, and they're trying to follow along off of there.
Today I'm speaking to you as a mom, a working mom of 3 wonderful kids, and I want to speak up for my kids, for the kids I see in my clinic, and for the kids of my coworkers and friends who are struggling with distance learning. This is not working for so many, and they need to get back in person with their teachers. I have a 16-year-old who is managing okay, logging in and getting things done. But I have a 14-year-old son that is really struggling. I can't monitor him on a daily basis when I'm in the clinic. I can't leave my patients during the day to check on to see whether he is logged in into the classroom. After working all day, I try to help him with lots of missing assignments, but it's not the same as his teachers. Kids like mine are old enough to stay home, but need the structure of being in school to help meet their academic, social, and emotional needs. I can't imagine having elementary kids and trying to do this. There are many days my son doesn't leave his room until I get home during the day, completely disengaged from his whole life. The isolation of our children has so many consequences.
As president of the National Honor Society, I've had students in and outside of the organization reach out to me, all struggling and concerned about their grades and their future, because high school leads to college and college leads to what someone's going to do with their life. So right now, we're being impacted forever. Yesterday I had one of my close friends send me a video on Snapchat of her crying because she failed math, and she's a smart kid, but just the way everything has been, it's been so hard for so many people to get motivated, and this is just not a fair way to learn. I'm an ambitious student, and I had to withdraw from a PSEO class because some things aren't meant to be learned online. You can't read a textbook and magically learn physics or calculus. You have to be there. We need the bond with our teachers. We need to be able to learn. You can't learn through a screen the same you can in person.